A very good evening to all. On behalf of IAP India technical team, I, Dr. Uttara Mohan, welcome you all to this webinar on basics of matrix rhythm therapy. We are streaming live on IAP India YouTube page for this webinar. Please subscribe to our YouTube page and Facebook page to get regular updates and to view our webinars. Okay. Today's webinar is being organized by IAPWC Thane District Committee of Maharashtra State. The moderators for today's webinar are Dr. Smriti Sorte, Dr. Jayagandha Patil, and Dr. Reema Ramka. So I request the moderators to commence with the session.
Good evening, everyone, and a very warm welcome to all of you, to all the students and the physiotherapists present here. Myself, Dr. Reema Ramka, the sub-coordinator of Thane IAPWC, along with Dr. Smriti Sorate, the coordinator of Thane IAPWC, and Dr. Jayagandha Patil, sub-coordinator of Thane IAPWC. I would like to speak a few words about IAPWC first. IAP Women's Cell was started on 30th May 2018. It functions under the guidance of the National Head Dr. Ruchi Varshini and IAP President Executive Dr. Sanjeev Jha. IAPWC works towards conducting public awareness camps, CME workshops. It aims at bringing together all physiotherapy professionals for sharing knowledge and improving public awareness about physiotherapy. We have 5 zones in India with heads for each. Dr. Pooja Kamble is the West Zone head. The state team of IAPWC Maharashtra includes State Coordinator Dr. Suvarna Ganvir, Joint Coordinator Dr. Snehal Patel, Sub-Coordinator Dr. Uttara Mohan, Dr. Priya Karande, and Dr. Nirali Sangvi. In Maharashtra, IAPWC has conducted 40 plus low-cost activities in various districts. In first Cooperate IAP conference held in Indore in April 2019, Maharashtra State received the Best Award for IAPWC. I would like to speak a few words about our speaker for the day, Dr. Sandeep Bhagwat. Dr. Sandeep Bhagwat has completed his Bachelor in Physiotherapy from Government Medical College, Nagpur in 1998. He has completed his Masters in Physiotherapy from Maharashtra University of Health Sciences, Nashik. He is the director of Nirmay Institute of Rehabilitation at Solapur since 2004, with special focus on rehabilitation of neurological and orthopedic disabilities. His center has been approved by Endolite India for high technology artificial prosthesis. He is the pioneer of many German therapies like matrix rhythm therapy, Mentamu, Magnetodin, and Liptocontour from Germany to India. He is certified instructor and conducts workshop on matrix rhythm therapy, Germany throughout India, and has trained various physiotherapists from different parts of the country. He has presented many papers at national and international conferences. He has patented several ideas to his credit. The idea of back-bending bench and stair-climbing wheelchair has received award at national level and will soon come into the market. He is nominated by the government of Maharashtra to State Council and is the Vice President of Maharashtra State Council for Physiotherapy, Mumbai. He is the member of Board of Studies at Maharashtra University of Health. That is all. Thank you. I would like to call Dr. Sandeep Bhagwat to take over the webinar.
Thank you, Reema. Thank you for the kind introduction, for all those kind words. I directly start with my presentation. At the very outset, let me thank the organizers, the IAP, the WC Thane, Dr. Suvarna Ganvir, Snehal Patel, Dr. Smriti Sorte, who have taken a lot of effort to put me on the screen. It is really wonderful to be here this evening. A very good evening, one and all. I directly start. The topic of today's webinar is matrix rhythm therapy. I have just seen Dr. Randoll, who is the inventor of matrix rhythm therapy, entering our webinar. I welcome you, sir, for this webinar. And with your kind permission, I begin my webinar. The most foremost question is, how did you come to know about matrix rhythm therapy? And can you tell us more about matrix rhythm therapy? I happened to visit Germany in 2009 for a formal training with matrix rhythm therapy at the Dr. Randoll's Institute, Munich. There, when I saw the results, it was very convincing for me. And from the very first day after coming back, I started to spread the word in India. I would like to share a few of my cases after coming back. On the screen you see, she is Rutika Sriram, a diving champion from my city. She represented the country at the Commonwealth Games in 2010 in Delhi. She's such a high performance athlete. During one of her practice sessions, she happened to injure her right shoulder and had restricted and painful movements of the right shoulder. She had seen most of the physiotherapists across the country, but hardly with any relief. One of my physio friend brought her to me. We recorded her pre-range of motion, and this was her range of motion on the first day. Her rotations were also restricted. Even her spine hyperextension was restricted, and she was out of the game for more than 2 years. After recording her ranges of motion, we started with the therapy. You can see she has a normal range of motion, internal rotation with the left hand, but the right hand is restricted. Again, left hand. And after her assessment, we started with the therapy program of matrix rhythm therapy, which was done for 1 hour once a week. And you can see a big difference in the range of motion at the right shoulder. Her pain also significantly reduced, and she was back to her sports, diving. Her scapulohumeral rhythm was also normal. We did a session of 1 hour at an interval of 1 week each for 6 weeks. And her internal rotation also improved. Pain was better. She even could perform asanas. She could do chakrasan in the clinic. And to bear weight on the right shoulder was very difficult. But after training, now you can see she can do an arm stand in the clinic. She was totally off her pain. Ranges improved significantly. Even her spinal movements improved. We did a session for the whole spine, paraspinal, as well as the parascapular region and the shoulder. So this therapy is basically indicated for restricted mobility and pain. This is again one of the first few cases that we did after coming back from Germany. It was a non-healing ulcer for more than 6 months. The surgeon had decided to put a graft, but was referred to me. We did 6 sessions of 1 hour each, and to my surprise, the ulcer had healed completely without putting a graft. This was very convincing for me that microscopy and macroscopy is connected and has a relation. He's Dr. Ulrich Randoll from Germany. He's the inventor of the concept, the matrix rhythm therapy. We have an opportunity to hear him once I complete the webinar. He studied general medicine, is a medical doctor, also did dental medicine in 1985, and after finishing worked as a medical doctor at the University of Erlangen, Nuremberg, Germany. Now let us understand the research. This is basically a research-based concept. So unsatisfactory results in his clinical practice led to rethinking of the conventional methods that were available at the university. And so he started his work on cell biology at the University of Erlangen from 1989 to 1997. It was a clinic coupled basic research. Patients were beheld from system theoretical findings and symptom formation as process derailments on the cell biological level. Progress of medicine is always a result of technical possibilities of the corresponding time. Following the trend of miniaturization, they studied the cell in function, and the study of rhythms and time patterns was studied 20 years ago, and which is missing in the modern medicine today. The tool that they had was a high resolution video camera and a light microscope which was attached to a computer. And for the first time, they could see the cell processes at fresh. And this, when they could see the cell processes, now the question was at what frequencies and what amplitude are supporting recovery, or which are specific and which are chaotic. These were put to test with the theories of physics. The discovery that biochemical and biophysical cell processes are connected to body internal rhythms and body external rhythms. Body external rhythm can tune body internal rhythms, brought them on track. So now the question was, what is the correct rhythm for a healthy life? And the focus was on skeletal muscle. Wrong rhythm correlated to pain and hardening. And healthy musculature synchronizes at 8 to 12 hertz. This was the basic finding of the research. Now coming to the symptoms, and the whole world is now, and even the WHO is paying for symptoms, but nobody looks at the pathogenesis and the etiology, or the cause and the reason for the condition. If you see a typical X-ray of osteoarthritis, we see this as an endpoint of the condition, but the processes has started to derail long back. This is just the symptom, is just the tip of the iceberg, but the processes have started to derail long before we see the symptom macroscopically. And so the systemic medicine treats the fruits as well as the roots. The process derailments have to be corrected at the cell biological level. So the roots and the fruits both have to be treated. And the question is, what is life? The difference, is it the difference between a human being and its dead body is life? And to understand these life functions and functional disorders and symptoms, we need to understand cell biology. We as physiotherapists have not understood the cell biology part so clearly. We are more macroscopic in our approach. So let's understand cell biology. So we physiotherapists must now focus on the cellular basis. And matrix rhythm therapy has a cellular basis. The rhythms and pulses estimates our life. And these cell oscillations are coherent living processes. Muscle cells work as coupled oscillators. And the coherence and self-organization are basic mechanisms of living systems. And we have these examples in the non-living systems also. This is a cell culture of 1,000 heart cells working coherently to maintain a rhythm. And the self-organization is also seen in the non-living systems. These pendulums are chaotic, dissociated in the first instant, now they start to synchronize, and diseases are disturbances in rhythm. Now there is an external disturbance or a blockage in the systems which lead to a symptom. So there is a disturbed rhythm of the pendulum now. And once these blockages are removed, the self-organization of the body takes place. You can see it in the non-living system now. The blockage is removed. It can be in the mind and the matter, in the chemistry. And once this blockage is removed, the pendulums again start to associate, to synchronize, and re-establish the lost rhythm. So rhythm, without rhythm, there is no life. And you can see and measure most of the rhythms. The brain has a rhythm, the heart has a rhythm, muscle curing also has a rhythm. And the most interesting part is the alpha rhythm and the muscle curing rhythm interact with each other. And when this muscle curing is activated, it is activated right up to the microcirculation level. This can be stressed, rhythm can be stressed by various means: mechanical, chemical, electromagnetical, even emotional. And now the question is how to maintain the harmony in the muscle and the harmony in the system. Principles of octave in the human body, and if you see, they all follow an octave: 20, 10, 5. So are coherent rhythms master clocks of our life processes? Yes, they are the master clocks. They produce a rhythm. The rhythm is generated at the cell level, and the extracellular matrix is the environment around the cell. And the 70 trillion cells of the body are like fishes in the water. Consider your body as an aquarium with fishes as cells. And these fishes are bathing in the extracellular matrix. Similarly, the cell also floats in the extracellular matrix. And blockages in this extracellular matrix or bad logistics on the cellular level causes successively symptoms macroscopically. These blockages in the system have to be removed, and the system readapts. So let us understand the ECM. It is the environment of all the cells. The extracellular fluid is the fluid that is not contained in the cells, but it is outside the cells. And this is the environment of the cell. If the environment is good, the cells survive. If they are well fed, the cells survive. But if the environment is not good, it's bad, the cell ultimately dies. The ECM, it is often secreted by the cells to produce a constant environment of cellular functions. It is the link for all communication between all the body cells, the information physical and chemical. It is the origin of the lymphatic liquids and needs permanent logistics to guarantee metabolism. The logistics is very important in the ECM to estimate the process of healing. Cells of the body are floating in the extracellular matrix, and all cells, when alive, oscillate rhythmically, and they produce a rhythm coherently. They all have an identical frequency and amplitude. The logistics of the ECM estimates the process of healing. The arterial side, the venous side, and then you can see the gray area, the lymphatics, they all have to flow to guarantee a metabolism. And this logistics in the ECM is very important for the process of healing. And you have blockages in this ECM, which leads to symptoms macroscopically. And now you see the microcirculation as the basis of all the systems, the neurology, the gastroenterology, myology, osteology, dermatology. And once you activate the muscle curing, it goes down right up to the microcirculation. Even the bone needs microcirculation. So the myology is at the center of the process-oriented biomedicine. 45% of our body is muscles. And consider your body without muscles. There will be no circulation, no rhythm, no process, and no processor after all. So the muscle being the focus, the muscle curing is the same with all of us. This is the milking effect. The physiological milking effect is nothing but the curing of the muscle. And it does in extreme situations to avoid cell death, the physiological lymph drainage. It is not the stockings that is really helping, elastic stockings that we use, but the muscle curing that drains the lymph from the ECM. In extreme situations, the skeletal muscle cell synchronizes at 8 to 12 hertz. And in extreme situations like fever, orthostatic collapse, and it's the same in all of us. We all have the identical frequency, and this is the rescue frequency in all the human beings. And when this muscle cures, this is the flow that is observed in the ECM. And this flow takes place in the lymphatic system. So understanding of the lymphatic system is also very important. Just take a quick look at the lymphatic system of our body.
The lymphatic system is part of the body's circulatory and immune systems. It helps to move and drain body fluid and fight infection and diseases. The lymphatic system includes lymph fluid, lymph vessels, and lymph nodes. Lymph fluid is a clear and colorless fluid that contains mainly white blood cells and proteins. Lymph vessels are tube-like structures. The larger lymph vessel on the left side of the body is the thoracic duct. The larger lymph vessel on the right side of the body is the right lymphatic duct. There are also many small lymphatic vessels. Lymph fluid moves through the lymph vessels and carries cells that help fight infection or diseases. Lymph nodes are small oval or bean-shaped structures arranged in grooves or chains along lymphatic vessels throughout the body. Lymph nodes help to filter and remove possible harmful substances and to drain the lymph fluid. Every person has a different number of lymph nodes, generally between 500 to 1500 lymph nodes. The sizes of lymph nodes in each person are also different, between 0.2 of a millimeter, or as small as a sesame seed, to 30 millimeters, about as large as a grape. The thoracic duct collects and drains 75%, or the majority of the body's lymph from the left side of the body, the abdomen, and lower extremities. The lymphatic duct collects and drains the remaining 25% of the body's lymph from the right side of the head and neck, the right arm, and the right thorax. These large lymphatic ducts empty lymph fluid into veins under the collarbones to the heart, where lymph fluid is returned to the bloodstream. About 3 liters of fluid are removed through the lymphatic system every day. When lymph nodes or lymph vessels are damaged or blocked, fluid cannot be drained from body tissues. This causes fluid to build up and may lead to swelling or lymphedema. Lymph fluid only drains when we perform deep breathing that stimulates lymphatic ducts and when we have muscle movements that create muscle milking and pumping action to drain lymph fluid.
So now you see the blockages in the lymphatic system leads to swelling. So what we see swelling is nothing but the blockages in the system. So the logistics in the ECM is very important, and these blockages have to be removed to ensure the processes of healing. Matrix rhythm therapy in the frequency range of 8 to 12 hertz is responsible for the flow in the ECM, in the venous as well as the lymphatic system, and this guarantees the logistics. And this logistics of the ECM estimates the processes of healing. Here you can see a high resolution cell, a pulsating cell. This pulsating cell, when it contracts, it loses its charge. So to generate a force, we always think of a contraction, but at the cellular level, it is just the opposite. When the cell loses its charge or depolarization, it is a passive process. It goes in a state of contraction. And to repolarize it again, it needs energy. And this energy comes in the form of ATP, adenosine triphosphate. So for a relaxed state, it is the energy that is very important. And this comes from the ATP molecules. Our body produces 1.5 times the body weight of the ATPs needed. Sports person even produce more than 2 to 3 times of the ATPs. So contraction, now you see the contracted cell, when it loses the charge, depolarization, it is a passive process. And to come back to its original pulsating state, this state, it needs energy, and this energy comes from ATP. So this contracted muscle cell is because of lack of ATP, and this remains and produces acidosis, or these are the areas of rigor mortis even in a single muscle fiber. And this further leads to fibrosis, necrosis. So the aim is to get back the relaxed state, and this comes in the form of ATP. So we need to have an understanding of how the ATP is produced in our body. Here is a short video to understand the ATP production at the level of mitochondria.
Life, as you well know, is an energy-intensive process. It takes energy to operate muscles, extract waste, make new cells, let the brain process and send messages, and even, from time to time, do some serious thinking. An organism's entire energy budget is spent on the cell level. In some cells, as much as half of a cell's energy output is used to transfer molecules across the cell membrane, a process called active transport. Cell movements require energy, and thousands of energy across the cell membrane. Cell movements require energy, and thousands of energy-hungry chemical reactions go on in every living cell, every second, every day. The folded inner membrane is studded with enzymes. These enzymes, ATP synthase, offer an opening through which hydrogen ions can escape. As they exit through ATP synthase, they generate the energy required to bond the terminal phosphate onto ADP, converting it to ATP. That's it. That's how the ATP battery is recharged. But what happens to all those carbon atoms that originally made up the fuel molecule? In the process, they combine with oxygen to form CO2, carbon dioxide. Carbon dioxide leaves the mitochondria and escapes through the cell membrane, where it's picked up by the bloodstream and transferred to your lungs, ready for a good exhale. That's animal respiration, burn fuel molecules, make ATP, carbon dioxide out.
So here we understand how the ATP is produced in the body, and the contractions of and the pain are the cry of the tissue for oxygen. And when you have circulation and oxygen, there is a production of ATP and thereby release and relaxation of the muscle. So at the end, most of the diseases can be said that they are diseases of mitochondria. So this contracted tissue leads to impaired circulation and prevents movement and hurts. There is a disproportion between the belly, contracted belly, and the tendon. If the belly is uptight, you have weak and thin tendons. You see a gymnoholic having a calf injury and a very tight ruptured tendon, calf tendon, because of an acidotic training. So the relaxation is necessary, and he is not elastic. He may be flexible, but he is not elastic. So what is the force that is generated? It is the mass and the acceleration. But the muscle work is the mass, acceleration, and the distance for the muscle to produce a force. So these are the contracted areas. You see the pain around in the arthrosis is not basically from the cartilage. It is because of the periarticular contracted areas. The hip and knee, they produce. The pain at the hip and knee is because of the soft tissue, contracted soft tissue, that they produce high forces at the cartilage, and we see is as osteophytes. The pain doesn't come from the osteophytes, but rather the contracted areas and the contracted muscles. And this leads to the arthropathy. So diseases and aging are the process of loosening of the body and elasticity. So over a period of time, we tend to contract because of the blockages in the body and the mind, and there is a lack of range of motion, and this leads to chronic pain or arthritis. So how to remain elastic and harmonic in mind and body as long as possible is the main question. And this is the pain syndromes by contraction remains. The cellular energy crisis are the acceptable pathophysiological models for explanation of myofascial pain syndromes. As we have already seen, the deficient energy metabolism at the cellular level must be normalized by adequate therapies before we start with our macroscopic exercise programs. So passive before active. And how is it done? On the basis of these findings, a therapy was designed to intervene the process derailments on the cellular level, that is the matrix rhythm therapy. A purpose-built resonator is placed on the muscle to be treated, and the physiological oscillation processes are normalized by phase synchronous magnetomechanical oscillations in a freely adjustable range of 8 to 12 hertz, thus normalizing the cellular rhythm as well as the flux density in the extracellular space. The blockages are removed and the healing follows. Thus, the derailed biochemical and biophysical processes coupled to this rhythm are reactivated, readapted, and this is the entrainment effect that is done with the matrix therapy. So based on the biological importance of body specific rhythm in healthy tissue, coherent magnetic oscillations are reintroduced in the body in order to reactivate, or rather regenerate, readapt the biophysical processes which are coupled to the rhythmic action but are out of sync. So these are the physiological rhythms that are introduced in the body, and they do no harm without side effects to readapt the pathophysiological processes. And it confirms to the form of nature. So we don't harm and doesn't harm the body with no side effects. These are the physiological oscillations, just bringing it back in rhythm. Specific effects of matrix rhythm therapy is activation of metabolism, acceleration of flow of the venous and the lymphatic channels, activation of the immune system, which is very important in these days, the targeted removal of muscular reminiscences or the contracted residues. The physical effects are thereby there is a reduction of tissue fluid absorption, strengthening of the muscle's own physiological resonance, the direct and indirect piezoelectric effect, and restoration of colloid osmotic tissue tone, improvement of the mechanical magnetic coherence. The chemical effects, acceleration of thixotrophic reaction from gel to fluid so that it flows. There is a reduction of viscosity, regulation of interstitial pH, and increase in the tissue temperature to normal temperature. Now we come to the indications. As I already said, that is for restricted mobility and pain. We have used it extensively post-traumatically in most of the orthopedic conditions, post-trauma, after immobilization, and adhesive capsulitis. Then there is an acceleration of functional and structural nerve regeneration, carpal tunnel syndromes, peroneal nerve damage, and even the immobility of the nerve. There is an acceleration of regeneration during illness or of a chronic degenerative nature like rheumatism, ankylosing spondylitis, and the restoration of function of the fine vessels in the even in the skin, cutis, subcutaneous layers, the ulcers. We have already seen the ulcer healing. So this is the indications. And reduction of swelling by removing the lymphatic blockages, improvement of elasticity, adhesions, scars, contractures, flexion deformities, local hypertonia, hypotonia, and to correct the intra and intermuscular imbalances. Pain, of course, is the mainstay of the therapy. Pain management of acute and chronic condition, overstretching of muscles, backache, paresthesias, and migraine. Contraindications are really few. Open or inflamed infectious surfaces, fresh fractures, they don't see us, tendency of bleeding, embolism. Pacemaker is a relative contraindication. Direct contact to the bones, we avoid. Direct contact to the eyes. I would like to mention that pregnancy is not a contraindication. It is a physiological process and we use it for pregnancy related pelvic girdle pain. So it is an indication and not a contraindication with this therapy. So to sum it, life is rhythmic movement. Diseases are disturbances until stop. So basic therapy must be readaptation of rhythms on the level of cell biological regulations. And we do it with this matrix mobile. This is an extended arm of the physiotherapist that I can say. This is how we start at a 10 o'clock position. And it's a freely adjustable range. If you see frequencies, these are not fixed frequencies. These are in a frequency range of 8 to 12 hertz, so they don't harm. Fixed frequencies do harm. So this is how it is done on the body. Micro mobilization, first passively and then actively. The red markers are the areas of pain. So this is done very softly and gently. And now you see the macro movement along with micro mobilization and passive and then active exercises. Micro to macro, passive to active. These are the difficult areas to treat with conventional therapies, but we can very well do it with the matrix mobile, the sternocleidomastoid. We have treated a lot of torticollis, and we relax the muscle. Bone follows the muscle, and we have seen a correction in the deformities also. This is how it is done on the body. And thereby we
Something is disconnected.
Yes, sir. We are looking into that. Sir, can you start with your presentation?
So I should just give some commands from my side, or
Yes, please.
yes. So first of all, I want to thank Dr. Sandeep Bhagwat for. Let me see. Yes, now you can see me also. Hello, everybody. So first of all, I want to thank Sandeep Bhagwat for his very nice presentation with the small overview about matrix rhythm therapy and also a little bit about the concept. Of course, it's not possible to present everything and to go into the details in such a short time. So I can answer questions for the participants, or I can also give now a small statement from my side. So what is preferable for you?
You can give the statement and then we'll go for question answer.
Okay, so the matrix rhythm therapy and the matrix concept, I'm in since 20 years. And as you know, I come from structure, from surgery. And I saw that the diseases are at the end always, and the symptoms are at the end always derailments of processes. That means at the end, life is a process and not a structure. And the different symptoms we have in our mind are just definitions from our mind. A cell never says, I have a disease on the cellular level. A cell just can say, I'm in a very bad condition. I try to do my very best, but the result is you have to decide good or not. And so the cellular system is always adapting to the environment. So when you have a traffic jam in the big towns like Mumbai or Delhi, or the air is not so nice, then of course you see the result in different symptoms in the people. You even cannot transport nutrition when you have traffic jam. And the same principle that you have in the society, you say on another dimension, when you have to try to socialize your cells in the body. As we heard already, we have trillions of cells in the body, and at the end, they are playing together like the musicians in an orchestra. And when they have a good nutrition, they play a nice symphony. And if they have some of them not enough nutrition, then you get a derailment, and then you have just cacophony, or you have not harmonic systems. So these principles have guided me to the rhythms. And so I came from surgery to physiotherapy, because physiotherapists, all of you, you are process managers of the whole system. That means you are dealing with electrical frequencies, with mechanical frequencies, and also with magnetical frequencies. You are using the vibrational shivering treatments. So the physios are always process managers. And the question is now, when we listen to the details of the body, you know, we heard about mitochondria, molecules, ATP, and all these things. But how can you reach an ATP molecule? It's not possible. So my answer was to all of this, if at the outcome are rhythms, then I have to first ask, what kind of rhythms does the human body produce? And we are producing alpha rhythms, beta, and so on and so on. You saw all of them. And so I tried to figure out, to find a crank, you know, like a crank handle, you know, a starter with in the same range of the rhythms the system produces. So now I developed this matrix rhythm therapy. That means we apply the rhythm to the body that we expect when the body is healthy. And the interesting point is that all of us, when we are shivering like this, we are in the same frequency range, and this is 8 to 12 hertz. And this is exactly the frequency for the metabolism. It's a starter for the circulation, especially for the lymphatic and venous drainage. And so when you have open spaces by this vibration, you get fresh blood from the arterial side. And this is like a gardener does, bringing fresh water into the garden, and the plants are growing. And this happens now because all the biology is self-organized. That means the healer is within, and we are the starter. Nobody of you is the healer. You are the starter for the healing processes, all of us, even the surgeon. When the surgeon is finished, then the healing starts on the cellular level. And so the healing, as Sandeep mentioned very kindly and very nicely, starts from micro to macro, from the microcosm to the macrocosm, and from passive to active. This is my statement. So we have workshops in India also, where we just practice these things and we go more into the details. Today, it's just a little introduction to all these topics. Does anybody has questions?
There are a lot of questions. Smriti, can you take over?
Yes. Good evening, sir. There is a question. There is a question which says that if matrix is contraindicated in open areas, then how it heals the wounds?
So of course you never go inside a wound, but you go outside the wound, especially when you just reflect if there is a lymphatic blockage. Then you have to go, for example, when you have a calf muscle or tendon problem like we saw before, then you go directly to the calf muscle and to the upper leg. That means according to the rules of the lymph drainage, everybody knows, we go from proximal to distal, but not by just massaging with the hands, but by shivering, because the shivering is the physiological lymph drainage. This we have to reflect. Always when the body is shivering, when you have temperature, or when you have orthostatic collapses, or a weightlifter takes the weight and starts shivering. When the body is shivering, then the lymphatic drainage starts. And so when you have open wounds, you go proximal of the wound, and then of course you open the venous and the lymphatic blockages, and fresh blood comes. And so self-healing just happens.
Okay, thank you, sir. Can matrix be used for kids?
Can matrix be used for?
Kids. So it will be nice if you can tell the age range. Like many people can have the question if it can be used for kids or maybe for geriatric. So you can elaborate on this, sir, please.
I don't understand.
Can matrix be used for kids?
For kids,
for small babies.
Of course, kids. You can use it, and it is used in India in cerebral palsy children, you know. And of course, you can use it in every age. Of course, very softly and very tiny. You know, you have to be very careful But the principle of all warm-blooded animals, I can say, even we use it in horses, you know, in racing horses, because the principle of the circulation is in the all warm-blooded animals the same. And we are treating the principle of nature and not so much the disease. Because when we pose the question, how individual are diseases on a cellular level? As you know, at the beginning, we start with a sperm and an egg, you know, they come together and produce a human body. So we go to the principle of healing and not so much to the different symptoms, because all the symptoms are at the end derailments. If you go to the bone, to the liver, to the kidney, it's all derailment of the cells, and they work with it according to the same biological principle. It is like if you go to the car industry, they have different models in cars, but the same principle of engine. It's an Otto engine or diesel engine. And we are treating the principle. And so you can use it in many symptoms and in all kinds of derailments of process disturbances. And the point is, because we are in the physiological range of the shivering, we can never harm, because if something is not in this range, it's not tuned according to nature. And this is the trick.
Okay. Okay. So the last question, does matrix rhythm therapy affect the sympathetic system?
So you mean activate or opposite? So
Okay.
when we are working on the paravertebral spine, we are just reducing the sympathetic load, because we are just working paravertebral, and there's the sympathetic trunk, and we go deep. We go 7-8 centimeters underneath the skin, and there directly at the small heads of the ribs, you know, there is the parasympathetic and sympathetic trunk. And when we release these areas by mobilizing the whole chest, you know, then we release the system, and we get also we activate the afferences, and by activating the afferences, especially by the Golgi tendon apparatus of each muscle, then we get reflectorily a release of the whole system.
So one last question. There is no digital screen on matrix device. How do we know which frequency we are applying?
So when there's a small button on the machine, and when you put it on around 10 hertz at 10 o'clock, then you have around 10 hertz. And this is exactly the shivering. That means, and the other way how to find it is, you just shiver with your muscle like this, you know, you shiver with your hands like this, and then you directly see if the shivering of your body correlates to the machine. And this is the resonance frequency you should apply. So you especially you feel it directly, and the machine is nothing else like your elongated arm. And with your arm, you can also make, for example, like this vibro massage, like this, you know. And instead of using your arm, you take the machine. So it is just an elongated vibro massage, you can say, where you use the machine, and this makes your life much easier.
Okay. Okay. Thank you so much. So we have many more questions, but I think that can be asked. I request all the participants to ask the question on WhatsApp, and it will be duly answered. Okay, sir is there on WhatsApp group too. Thank you so much for your time. I hand over to Dr. Jaya, please.
Thank you for being with you. Thank you so much. Have a nice time, and I hope to meet all of you personally when I'm in India for the next workshop, and we do the hands-on. And believe me, start now. And we have instructors, wonderful, like Sandeep, and there are a lot of others instructors. All of them are trained by Mr. Anil Deshpande, who is our very, very active representative in India. And so they can tell you much more about the practical side. Thank you so much.
Okay, thank you, sir.
Okay. Thank you so much, Dr. Sandeep Bhagwat, sir, for enlightening us with their knowledge and experience. Special thanks to Dr. Randoll, sir, for taking out time and enhancing our knowledge more on the topic. Thank you to all the physios for the presence, and thank you Maharashtra State Coordinator Dr. Suvarna Ganvir Ma'am and State Joint Coordinator Dr. Snehal Patel for guiding us and helping us whenever needed. Thank you our Zonal Head Dr. Pooja Kamli and National Head Dr. Ruchi Varshi for having faith in us. Thank you so much Dr. Utra Mohan, Dr. Priya Karande, Dr. Nirali Sangvi and the entire technical team for always being there to support us. If anyone still has some questions, please feel free to put it on the WhatsApp group and requesting you all to put your feedback on the link given in the chat box. Thank you so much. Have a great day ahead.
Thank you.
Thank you.
Thank you.
Thank you, sir. Thank you, all
Thank
of
you.
you.